Well, joining me now to talk more about the efforts to change the state laws is the president of the State Nurse Practitioners Association, Seth Gordon. Thanks so much for your time.
Thank you, Steve.
I want to first just talk about some of the broad issues, and we'll get to more specifics so we can make sense of this for folks who aren't familiar with the industry. But a big healthcare problem. You say it's a shortage of primary care physicians, and this really can impact folks. So how big a problem is this?
You know, I think it's a major problem, and it's a major problem that only promises to get worse. Right now, nationally, they're predicting anywhere from 45 to 50,000 fewer primary care physicians that are necessary than it is to meet demand for them. It's a major problem for the 11% of New York's population that lives in underserved areas throughout the state, because they already have difficulties finding primary care.
So bring me through then, what are sort of some of the steps in New York that Caitlin spoke about and that we were talking about where you can fill the gap, you can change things and perhaps give more of a role to nurse practitioners? What are you advocating?
Well, nurse practitioners are experts in primary care. You got to remember, they come into the field as registered nurses and they receive advanced education and training. And like physicians, they provide a broad array of diagnostic and therapeutic services. And in a comprehensive way, they can treat most of what any primary care physician can treat, yet the law mandates that they have a written collaborative agreement with the physician. And that's extremely problematic when you're looking for innovative solutions to fill the needs of our population. Nurse practitioners can fill that need. They've demonstrated that for the past 45 years since the inception of the profession. You got to go back a little bit in history and remember the whole profession was born in the first instance to fill the need of a new and burgeoning insurance program known as Medicare and Medicaid back in 1965, which, as you know, expanded health insurance coverage for the poor, for the elderly and disabled Americans. There was a perceived shortage of physicians at that point, and so the government infused a great deal of funding into schools and education to train nurse and nurse practitioners to deal with those types of access issues.
So that being said then, as we go forward and there's more folks coming in on the insurance rolls through the government mandated health insurance, then you're expecting that this would basically be a trend that continues and nurse practitioners can step up, right?
Absolutely. History repeats itself. We're now in a position to evolve the model.
So why is this important for patients then? If this collaborative agreement, which you say is stifling to health care being given to folks, what does that change for patients when they actually go?
Well, I'll give you a great example. Heather Muxworthy in Rochester, New York. She's trained in the specialty of psychiatry as a nurse practitioner. She lost her collaborating physician due to no fault of her own and can't find another collaborating physician in Rochester, New York, which has, you know,
big population.
Big population. It has excellent medical care in the area. And Heather cannot find a collaborating physician, and after 8 years is forced to close her practice and seek employment with a local hospital. Ask her patients. She's got a caseload of almost 900 patients and 2 clinical social workers to fill a gaping hole in mental health care in Rochester, New York, which now becomes a larger hole to fill with her not being there.
So let me ask you then, where is this legislation in terms of breaking that collaboration so that way someone like her could do what she wants to do without having to work with someone else?
Well, right now it's before the legislature, before the higher education committees in both houses.
And how likely do you think it is that something like that would pass?
We're making great progress this year. We've nearly doubled the amount of sponsors in both the Senate and the Assembly. As I go around and speak to senators and assemblymen and women about this, consistently there's an understanding that there is a need, that there is a problem, that our population is getting older, our population is growing. They predict in the next 40 years nationally we're going to see 100 million more people. We're going to see people age 65 doubling in the next 40 years, and right now 17% of our state's population are age 65 and older.
So does this streamline the process, or you know, more broadly, not for individuals, but just the overall healthcare system? Does it make it more affordable, more efficient, any of that, or is it just what you think needs to happen?
No, not at all. All of the above. It makes the system affordable from the standpoint that Here you have a healthcare provider whose scope overlaps with a physician. In those specific areas where those scopes overlap, why should your viewers and the population of New York be forced to pay more money for care that's equally as good, if not better, in certain specific areas that nurse practitioners can deliver?
I want to ask you, this is assuming, some of this is assuming that there are going to be more people because of the health care reform that just passed, President Obama's health care reform, as it's perhaps known, that it's going to call for more doctors or more primary care physicians because there's going to be more people who are forced to be insured or mandated to be insured is the nicer word, I suppose. And yet those folks have always, some might say, been able to obtain service, whether it's through emergency rooms or clinics, other things. Is that true? What do you think about that?
Well, it is true that access to care right now for the underserved population can occur in emergency rooms where they can find an emergency room close to home. But it's also true that by adding, and I think the American College of Physicians came out with a study on this, that if you add one primary care provider to a ratio of 10,000 population, you're going to see over a 5% decrease in hospital admissions, 5.5% decrease in outpatient